If you are over 60 and feel that your strength is not what it used to be, if climbing stairs is no longer easy, if carrying groceries has become a challenge, or if you simply avoid certain activities because your body can't take it anymore, you are not alone. The sad reality is that millions of people over 60 are taking vitamins that are actually sabotaging their muscle strength and putting their health at risk. Meanwhile, they completely ignore the 4 scientifically proven supplements that could restore the vitality and strength you thought you had lost forever. Today, I'm going to reveal exactly what these 4 dangerous vitamins are that you should stop taking immediately, and the 4 essential vitamins that can transform your muscle strength and quality of life in the next 30 days. Because you deserve to live with energy, independence, and confidence, no matter your age. Oh, and before we dive in and uncover these secrets, just make sure you're subscribed to the channel. It's super important because the next content we're going to bring you will be essential for you to continue taking care of your muscle health and living with more strength and energy. That way, you won't miss a thing. The 4 dangerous vitamins you should avoid after 60. What if I told you that the vitamins you're swallowing every morning could be slowly harming you? It's a hard truth, but an important one. According to studies by JAMA, a highly reputable medical journal, older people who take the wrong supplements have up to a 40% higher risk of dying prematurely. This isn't just talk, it's real research data. One vitamin on this list is linked to brain shrinkage. Another increases the risk of stroke, nerve damage, and heart problems, even when taken in normal doses. And you're probably taking this vitamin every day. After age 60, your liver slows down, your kidneys don't eliminate excess substances as well as they used to, and your nerves are more fragile. Even so, these dangerous vitamins accumulate, poison your cells, and mimic symptoms that you chalk up to getting old. But it's not age, it's something we can prevent. In this video, we'll tell you which 4 vitamins you should never take after age 65 and the 4 you should start taking every day. Stay tuned until the end, because the number 1 vitamin on our good list is linked to a 36% lower risk of dying from any cause, according to a large European study. Before we get started, tell us in the comments, where are you watching us from today? We love hearing from older people around the world who are taking care of their health. But first, we need to talk about the bad guys, starting with a vitamin that may seem harmless, but can silently cause serious damage over time in older adults. 4. Vitamin A in the form of retinol, the silent accumulation that hurts. Vitamin A sounds like one of the good ones, right? After all, it helps your vision, your immune system, and even your skin. It's a vital nutrient for overall health. However, the truth is that for people over 65, especially those who take multivitamins or liver-based supplements, too much vitamin A, particularly in the form of retinol, the preformed active form, can silently accumulate in your body and lead to a toxic excess. Think of it as a dripping faucet in a bucket that doesn't drain properly. Over time, the bucket overflows, causing problems. Here's what most people don't realize. Vitamin A is fat-soluble, meaning it dissolves in fat. This means that your body stores it in your liver and fatty tissues instead of easily eliminating it through urine, as is the case with water-soluble vitamins, such as vitamin C or the B complex. And as you age, your metabolism slows down, your liver function may not be as efficient as it once was, and your body fat stores may change. The vitamin A you take today doesn't disappear, it accumulates over time. This excessive accumulation becomes toxic, and the symptoms are very subtle at first, which makes them even more dangerous. Dry skin, dizziness, blurred vision, and joint pain. You may easily think it's just a sign of aging, but it could be chronic vitamin A poisoning, especially if you're taking more than 2,000 to 3,000 micrograms, or 6,600 to 10,000 IU per day from supplements. The situation gets worse when we look at the heart. A 2022 review published in the European Journal of Clinical Nutrition found that excessive vitamin A intake in older adults was linked to a 25% higher risk of atrial fibrillation, a type of heart arrhythmia, irregular heartbeat, that dramatically increases the risk of stroke after age 65. Imagine that your heart, which already works so hard, starts to beat out of rhythm because of an excess you didn't even know you were accumulating. It's a real and silent danger to your heart health. If you're over 65 and still taking a supplement that contains retinol or retinol palmitate, it's time to seriously rethink. Your body does need vitamin A. It's vital for many functions, but not in this synthetic excessive form. Nature offers us a much safer alternative: beta-carotene. You can get plenty of vitamin A from foods such as sweet potatoes, carrots, spinach, kale, and eggs, where it is present as beta-carotene. Beta-carotene is a precursor to vitamin A, which means your body only converts it to vitamin A when it really needs it. It's like having a smart, automatic control that prevents excess, ensuring you get the benefits without the risks of toxicity. The risk of beta-carotene overdose is virtually zero. And if your multivitamin still includes retinol, check the label carefully. Anything above 700 micrograms, 2,300 IU per day for women, or 900 micrograms, 3,000 IU for men, can be dangerous, especially in the long term. The safest approach is to abandon the synthetic version altogether and stick to natural sources of real food. That's the first warning. Get ready for vitamin number 3, which is even more dangerous and often recommended to older adults without the proper testing. 3. Iron as a supplement. The buildup that oxidizes inside iron is a mineral that is essential for life. It is crucial for the formation of hemoglobin, the protein in red blood cells that carries oxygen to all the cells in your body, including your muscles and brain. However, for older people, iron supplements can become a silent and slow threat. If you're over 65 and still taking iron just in case, without a clear medical diagnosis of deficiency, it may be doing you more harm than good. Most people think of iron as a fatigue fighter or an energizer. Doctors prescribe it for anemia, and it is often added to multivitamins for seniors, sold as something that helps with tiredness or brittle nails. But here's the truth that most people don't hear, and that is crucial to your health. After age 65, your body stops losing iron the same way it did before. Men stop losing iron after puberty, and women stop after menopause, unless there is significant bleeding. And that iron that isn't lost doesn't disappear. It accumulates. Unlike water-soluble nutrients, iron is stored mainly in your liver, heart, and pancreas. Over time, too much iron causes oxidative stress. Imagine that your cells are like sliced apples. When exposed to air, they oxidize and turn brown. Excess iron in the body does something similar. It generates unstable molecules called free radicals that begin to damage your cells, inflaming tissues and aging your organs from the inside out. It's like internal rust that spreads, affecting the function of vital organs. In addition, excess iron increases the formation of something called lipid peroxides, harmful compounds linked to neurodegenerative diseases such as Alzheimer's, various types of cancer, and heart problems. The problem is that very few older adults actually need iron supplementation, unless you have been diagnosed with iron deficiency anemia, or have lost blood due to surgery, ulcers, or a chronic condition that causes bleeding. You are probably getting more than enough from your daily diet. Lean red meats, beans, lentils, dark green leafy vegetables such as spinach and broccoli, and even fortified cereals provide iron naturally. When you add a supplement on top of that, you tip the balance and can trigger long-term damage. The symptoms of excess iron are easy to confuse and therefore often ignored. Muscle and joint pain, unexplained fatigue, memory problems, loss of libido, or heart palpitations. It is often mistaken for normal aging, but behind the scenes, that extra iron is doing silent and progressive damage to the brain, liver, and heart. And unlike iron deficiency, which your doctor can easily resolve with controlled supplementation, iron overload takes time to correct, sometimes with phlebotomies, which is the removal of blood, and the damage may already have been done. If you take a multivitamin with iron, stop and talk to your doctor. Ask for a serum ferritin test, which measures iron stores in the body, and transferrin saturation, which indicates how much iron is circulating. These tests will tell you if your iron stores are high. If they are, you may need to reduce your red meat intake and stop all iron supplementation immediately. A better approach: choose multivitamins without iron, especially for older adults. Iron can be helpful when you're young and growing or losing blood, but at age 65 or older, it's like pouring fuel on a fire that your organs are too weak to put out. Ready for vitamin number 2? This one is even more common, often taken daily by well-meaning seniors, and may be slowly draining your muscles and bones without you even realizing it. 2. Calcium as a standalone supplement. Where does calcium go? Calcium has been a household name for decades, synonymous with strong bones. It's in every bone health ad for seniors, every doctor's office pamphlet, and almost every multivitamin labeled for strong bones. The idea that the more calcium, the better for your bones is deeply ingrained. But here's what most people over 65 don't know. Calcium supplements, especially when taken alone and in high doses, can actually increase the risk of heart attacks, strokes, and dangerous calcification of the arteries. This isn't meant to scare you. It's a conclusion based on recent scientific research. Calcium is essential for bone formation and maintenance, as well as muscle, nerve, and heart function. But where it ends up in your body matters much more than how much you take. When you are young, your bones act like a sponge. They absorb calcium quickly, with the help of hormones and growth factors. But after age 65, especially in postmenopausal women and older men, the calcium absorption and targeting system slows down and becomes less efficient. Bones stop absorbing calcium efficiently, and the excess calcium you ingest doesn't go away. It goes where it shouldn't, to your soft tissues, your joints, contributing to osteoarthritis, and, most dangerously, your arteries. Most older people are not aware of this. They take calcium thinking it is insurance for their bones, a guarantee against fractures, but their bodies cannot direct it properly without help. Instead of strengthening bones, this lost calcium can deposit on artery walls, hardening them, a process called atherosclerosis. This makes them stiff and prone to clogging, increasing the risk of heart attacks and strokes. Instead of protecting you from fractures, it may increase your cardiovascular risk. Worse, calcium supplements can cause digestive problems such as bloating, gas, and constipation, as well as reduce the absorption of other important minerals such as zinc and iron. And if you take reflux medication, antacids, which many older adults do to relieve heartburn, your stomach may not produce enough acid to absorb calcium properly anyway, so you end up with poor digestion. No real benefit to your bones, and more strain on your heart. So what's the best approach? Get calcium from food. Foods such as dark green leafy vegetables, kale, broccoli, spinach, sardines with bones. Yes, the bones are a rich and safe source. Yogurt, cheese, almonds, and chia seeds provide calcium in a safer form that your body absorbs and uses better, without the risks of taking too much. If you need more and your doctor confirms this need, make sure the calcium supplement is combined with vitamin D3 and vitamin K2. Vitamin D3 is essential for calcium absorption in the intestine, and vitamin K2 is the conductor that directs calcium where it should go, your bones, and away from where it shouldn't, your arteries and other soft tissues. This combination is crucial for safety and effectiveness. If your multivitamin still includes 500 to 1,000 becquerels of isolated calcium, and you already eat plenty of calcium-rich foods, it's time to rethink your strategy. Your bones need more than calcium. They need balance, movement. Weight-bearing exercise is vital for bone health, and proper nutritional guidance. And your heart needs you to keep calcium where it belongs, not where it hurts. Next up is the number one vitamin, the most dangerous of all for seniors. It's commonly recommended, often self-prescribed, and strongly linked to memory decline, muscle loss, and even death when taken without testing. Vitamin B6 in high doses, the silent poison for nerves. This one surprises most people. Vitamin B6 is often seen as harmless, a wild card you take for energy, nerve support, or to reduce brain fog. It's in dozens of multivitamins, and many health professionals recommend it for a variety of conditions. But after age 65, high doses of vitamin B6 can silently destroy your nervous system, decrease your muscle strength, and leave you with symptoms that look like old age, but are actually signs of toxicity. Here's what most people don't realize. Vitamin B6 is water-soluble, so logic would dictate that it's safe, right? That your body would simply eliminate the excess through your urine. However, B6 is different from other water-soluble vitamins. When taken in large amounts, especially from supplements, not food, it has a unique ability to accumulate in nerve tissue, and once there, it becomes neurotoxic. This means it starts to damage your sensory nerves, leading to a condition called peripheral neuropathy. Symptoms include tingling, numbness, burning sensations in the feet, balance problems, which increases the risk of falls in the elderly, and even muscle weakness. Many older adults with these symptoms are misdiagnosed with diabetic neuropathy, spinal problems, or simply old age, when the real culprit is excess B6. The official upper tolerable limit for vitamin B6 intake is 100 mg per day, but research shows that even lower doses, such as 50 mg daily, can cause toxicity in older adults over time. And the danger is that many supplements for energy, memory, or nerve support contain 100 to 250% of the recommended daily limit in a single dose. Add that to your multivitamin and fortified foods, such as some cereals, and you could easily be reaching toxic levels without knowing it. And once nerve damage begins, recovery is slow, difficult, and in some cases may be irreversible. Older adults are especially vulnerable to this toxicity for several reasons: slower metabolism, reduced liver and kidney cleansing capacity, and the presence of pre-existing conditions such as diabetes or thyroid problems, which already put stress on the nervous system. This means that an older person's body has a harder time processing and eliminating excess B6, making them more susceptible to its harmful effects. So what's safe? You still need vitamin B6, as it's important for the metabolism of proteins, carbohydrates, and fats, and for the formation of neurotransmitters, but only in moderation. The recommended daily amount is about 1.5 milligrams for women and 1.7 milligrams for men. You can get plenty of this from foods such as chickpeas, tuna, turkey, bananas, potatoes, and fortified cereals. Unless you have been diagnosed with a clinical B6 deficiency confirmed by blood tests, you do not need to supplement this vitamin in high doses. If your multivitamin or nerve formula contains more than 5 to 10 milligrams of B6 per dose, it's time to make a change. Switch to a formula specifically for seniors with safer doses, or see a doctor to have your blood levels of B6 tested. When it comes to B6, more is not better after age 65. More can mean permanent nerve damage. That wraps up the 4 dangerous vitamins that seniors should never take without medical advice. Now I want to hear from you. Which of these vitamins shocked you the most? Were you already taking any of them? Tell us in the comments. Your experiences are very important in helping others who may be going through the same thing, and if you have any questions about these supplements, feel free to ask. I read and try to respond to all comments. The 4 essential vitamins you should take daily after age 65. Now let's move on to the 4 most essential vitamins you should take daily after age 65, ranked from least to most important. These are the ones that can help you fight muscle loss and maintain your vitality, promoting a more active and independent life. 4. Magnesium in absorbable form. The forgotten master mineral magnesium is one of the most underrated nutrients and, paradoxically, one of the most important for healthy aging. It is often called the master mineral because it participates in more than 300 biochemical reactions in the body, affecting everything from muscle and nerve function to energy production and bone health. However, when you reach 65, your magnesium stores have likely declined significantly, and deficiency is extremely common among older adults. This happens for several reasons. With age, your ability to absorb nutrients in your gut declines, your kidneys eliminate more magnesium, and many common medications such as diuretics, used for high blood pressure and swelling, antacids for reflux, and some blood pressure and diabetes medications such as metformin, remove magnesium from your body even faster. The result of magnesium deficiency? A host of symptoms that are often mistakenly attributed to normal aging: constant unexplained fatigue, painful muscle cramps that wake you up at night, difficulty sleeping well, insomnia, anxiety, irritability, irregular heartbeat, and even insulin resistance, which can lead to type 2 diabetes. These symptoms come on so slowly that they become part of your daily life. But when magnesium is replenished, older adults often report dramatic improvements in sleep, better balance, fewer cramps, more energy, and even clearer, sharper thinking. Magnesium plays a key role in muscle contraction and relaxation, which is crucial for maintaining strength and preventing sarcopenia. It also regulates blood pressure, supports nerve function, and helps stabilize blood sugar. In addition, it keeps your heart rate steady and your brain functioning properly, contributing to memory and mood. In fact, magnesium deficiency has been directly linked to an increased risk of dementia, atrial fibrillation, and even type 2 diabetes. But not all magnesium supplements work well. Many common ones, such as magnesium oxide, are poorly absorbed by the body and often cause digestive problems, such as diarrhea, because they are more laxative. The best options for older adults are more easily absorbed, bioavailable forms, such as magnesium glycinate, great for sleep and relaxation, Magnesium citrate also helps with constipation, or magnesium malate, good for energy and muscle pain. These are gentler on the stomach and better absorbed by older digestive systems. The ideal dose for older adults is about 250 to 400 mg per day, depending on your diet and current health. You can also increase magnesium through foods such as dark green leafy vegetables, spinach, kale, avocados, pumpkin seeds, almonds, walnuts, and black beans. But since soil depletion has lowered the magnesium content in foods, supplementation is often necessary, especially if you take multiple medications. Next up is vitamin number 3, which boosts over 1,000 cellular functions, supports your immune system, and could dramatically lower your risk of cancer and respiratory infections after age 65. If you're enjoying these tips and realizing how the right foods can make a huge difference in your life, give this video a like now. Your like is like a thank you to us, and it also helps YouTube show this content to more people who, like you, need to fight muscle loss and live stronger. It's a simple gesture that helps us a lot to keep bringing you videos like this. 3. Vitamin D3, the sun hormone that protects everything. Vitamin D3 isn't just for your bones, it's actually one of the most vital hormones in your entire body. Yes, technically it's a hormone, not just a vitamin, and after age 65, your ability to produce it naturally through sun exposure decreases by more than half. This is because your skin can no longer convert sunlight, UVB rays, into vitamin D as efficiently. In addition, if you spend more time indoors, use sunscreen regularly, or live in regions with little sunlight, especially in winter, your blood levels can plummet without you even noticing. The consequences of vitamin D3 deficiency are serious and affect multiple systems in the body. Extreme fatigue, unexplained tiredness, bone thinning leading to osteoporosis and increased risk of fractures, muscle weakness, contributing significantly to sarcopenia and the risk of falls, low immunity, and a much higher risk of infections. But what's even more alarming is the connection to chronic disease and mortality. In a large 2020 review published in the British Medical Journal, older adults with vitamin D deficiency had a 50% higher risk of respiratory infections such as flu and pneumonia, and a 30% higher risk of dying from any cause, including heart disease, diabetes, and even some types of cancer. Vitamin D3 plays a direct and crucial role in how your immune system detects and fights threats. It activates defense cells, such as T lymphocytes, reduces chronic inflammation, which is a driver of sarcopenia and many age-related diseases, and improves your body's ability to repair damaged tissue. That's why people with higher levels of D3 not only get sick less often, but also recover faster. And in the brain, D3 supports memory, cognitive function, and mood stability. Low levels have been strongly linked to depression and a higher risk of dementia in older adults. But here's the problem. Most older adults are deficient, and most multivitamins don't include enough to correct this deficiency. The official recommended dose from Food and Sun is 600 to 800 international units, IU, per day. But robust studies show that most older adults need 1,000 to 2,000 IU daily just to maintain healthy blood levels. If your D3 levels are already low, and many are, especially in winter or in people with little sun exposure, you may need even more, always under medical guidance and monitoring based on blood tests. The best form to take is cholecalciferol, or D3, not D2. It is the most active, best absorbed, most bioavailable, and most similar to what your body naturally produces from the sun. You can take it in drops, soft gels, or capsules, and it is best absorbed with food, especially meals that contain fat, as it is a fat-soluble vitamin. Next up is vitamin number 2, a deeply underrated nutrient that boosts your red blood cells, nerves, and brain, yet many older adults are silently deficient in it, leading to weakness, memory problems, and even misdiagnosed dementia. 2. Vitamin B12, fuel for the brain and nerves. If you are over 65, there is a very real chance that you are already deficient in vitamin B12 and don't know it. The symptoms are subtle at first, which makes the deficiency difficult to identify. Persistent, unexplained fatigue, poor memory, brain fog, tingling or numbness in the hands or feet, and even difficulty concentrating. But over time, B12 deficiency can become severe and debilitating. It can mimic the symptoms of dementia, cause progressive weakness in the legs, affect your balance, increasing the risk of falls, and often isn't diagnosed until irreversible nerve damage has already set in. Vitamin B12 is essential for nerve health, forming the myelin sheath that protects them, red blood cell formation, preventing megaloblastic anemia, and brain function. It is like the fuel that keeps your nervous system running smoothly and the energy for your red blood cells that carry vital oxygen to all your muscles and organs. But as we age, our stomach loses its ability to absorb it efficiently from food. This is because older adults tend to produce less stomach acid and less intrinsic factor, a protein necessary for B12 absorption, both of which are crucial for separating B12 from the protein in meat, eggs, or dairy products. Add common medications such as antacids for reflux or metformin for diabetes, and the absorption problem worsens dramatically. The result? You may be eating all the right foods, rich in B12, and still slowly becoming deficient. This isn't just about memory. B12 deficiency can also cause leg weakness, difficulty walking steadily, and falls. This is because your peripheral nerves, those that connect your brain and spinal cord to your muscles and organs, begin to fail, sending wrong or insufficient signals. Many older adults think it's arthritis, spine problems, or just getting older. But the truth may be something much simpler and fortunately reversible with the right supplementation. So, how can you fix it? First, stop relying solely on food for B12. Once you're over 60, B12 from food is poorly absorbed, unless your stomach acid is strong and you have enough intrinsic factor. The best option is supplemental B12 in the form of methylcobalamin or cyanocobalamin. These forms of supplementation bypass the digestion process in the stomach and are absorbed directly through the mouth, in the case of sublingual supplements, or the intestinal lining. The ideal dose for older adults is between 500 micrograms and 1,000 micrograms per day, although some people with severe deficiencies may need more based on lab test results. B12 is water-soluble, so your body eliminates any excess that is not used, making it very safe. You can take it as a tablet, a sublingual lozenge, which dissolves under the tongue for quick absorption, or if the deficiency is severe and confirmed, a weekly injection. If you are over 65 and have not had your B12 checked recently, ask your doctor for a blood test to measure your levels. It may be the most important number on your blood test, because if your B12 is low, the rest of your body has to work harder and less efficiently. And if it's corrected, your brain, muscles, and nerves can function as if you were 10 years younger, restoring your vitality and clarity. Next, the number one vitamin, the most important vitamin for adults over 65. It protects your heart, brain, bones, and immune system. And in a large European study, it was linked to a 36% lower risk of death from all causes. Which of these vitamins shocked you the most? Or which one will you start including in your diet this week to boost your muscle strength? Leave your comment below. I am reading and responding to each one personally because your journey matters. 1. Omega-3. Fatty acids, EPA and DHA. The essential protective shield. This isn't your typical vitamin, but for people over 65, omega-3 fatty acids, especially EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, are as vital as any nutrient on this list. These essential fats, often found in fatty fish, have been studied more than almost any other supplement out there, and the scientific results are impressive and impossible to ignore. Omega-3s protect your brain, your heart, your muscles, your joints, and even your life expectancy. Let's start with the most recent and impactful science. A huge 2021 study in the European Journal of Clinical Nutrition followed more than 42,000 adults over the age of 60. The results were clear. Those with the highest levels of omega-3 in their blood had a 36% lower risk of dying from any cause. That's right, omega-3s weren't just linked to heart health, they were linked to living longer and better. Another study, published in the prestigious journal Circulation, showed that regular omega-3 supplementation reduced the risk of fatal heart attacks in older adults by more than 45%. These numbers are not small and demonstrate a significant impact on longevity and quality of life. Your body needs EPA and DHA to build and maintain the integrity of cell membranes throughout the body, especially in the brain and eyes. They are powerful anti-inflammatory agents, helping to reduce chronic inflammation, which, as we have seen, is a major enemy of muscles and contributes to sarcopenia. In addition, they keep blood vessels flexible and healthy, essential for good circulation and preventing cardiovascular disease, and regulate heart rhythm, preventing arrhythmias. Without enough omega-3, older adults are more likely to experience memory loss, cognitive decline, cardiac arrhythmias, joint pain due to inflammation, and accelerated aging in virtually every system in the body. However, here's the shocking part. More than 68% of Americans over the age of 60 are deficient in omega-3 simply because they don't eat enough fatty fish. The recommendation is at least 2 servings per week, or don't supplement properly. The best food source is cold water, fatty fish such as salmon, wild if possible, sardines, mackerel, herring, and anchovies. But to get the amount your aging body really needs for all these protective benefits, food is usually not enough for most people. That's where high-quality fish oil supplements come in. Look for one that provides at least 1,000 milligrams of EPA and DHA combined per day. If you have diagnosed heart problems, significant chronic inflammation, or other specific conditions, you may need 2,000 milligrams or more, always under the guidance and supervision of your doctor. When choosing a supplement, look for a formula that is tested for purity, free of heavy metals such as mercury, PCBs, and dioxins, and preferably in the form of reesterified triglycerides, RTG, or natural triglycerides, as these forms are better absorbed by the body than the ethyl ester form. Take it with a meal that contains fat to maximize absorption and reduce the chance of any fishy taste. And if you're vegan or allergic to fish, there are excellent algae-based omega-3 supplements that provide DHA directly, and some also contain EPA. Omega-3s aren't just about preventing heart attacks or strokes. They're an investment in your quality of life. They help you think more clearly, move more easily, sleep more deeply, and age better by maintaining your vitality. They literally form the structure of your brain and help your cells communicate with each other efficiently. And when you're over 65, that's not a luxury. It's a necessity for staying sharp, steady, and strong. For seniors looking to remain lucid, stable and strong well into their 70s and beyond, omega-3s are the closest thing we have to a nutritional insurance policy. They don't just help you live longer, they help you stay you longer, with more independence and quality of life. You've just seen the truth about vitamins after age 65. Some can help you live longer, think more clearly, and stay strong, but others may be slowly sapping your strength, clouding your brain, and putting your heart at risk, even when the label says, for seniors. It's not about taking more, it's about taking smarter. You need the right nutrients in the right form, in the right dose for your age, your body, and your future. That means cutting out the toxic extras and finally giving your cells the support they need to keep you alive, active, and sharp. So, what's in your medicine cabinet right now? Comment below and tell us which vitamin shocked you the most. Like this if it opened your eyes, and subscribe. We unravel the science that keeps you living stronger and longer. If you have any questions or want to share your own experiences, feel free to leave a comment below. Thank you so much for watching, and here's to a stronger, more vibrant you.